going to my family doctor for my physical, and everything, checked out well. And he asked me if I had any other problems, and I said my knees have been bothering. So he sent me to the specialist at PCI.
His x-rays showed advanced osteoarthritis. Sometimes we refer it as bone on bone, where he had lost all good cartilage inside the knee. Cartilage is the smooth surface, and once you lose all that, the rough surfaces of bone rub against each other, causing pain. Obviously, he was at a point where his quality of life was significantly diminished. He had pain with simple activities, and his activities of daily living were all painful.
I couldn't walk long distance, and I limped so bad, and it just got to where, I had to do something. Dr. Munjo told me that, both knees were bad, and that, they need to be replaced.
Mr. Hughes had a knee replacement done. It's called a knee replacement, but in real terms, it's knee resurfacing. It's a misconception that we cut the knees out and replace the whole thing. That's not true. We try to save as many inherent ligaments as possible. He needed both his knee replacements, and he had them 6 weeks apart.
You need time to get the other one healed up before you get at the next one, because there is a lot of physical therapy and exercises to do.
Knee replacement surgery. After the surgery, you will require regular physical therapy for next 4 to 6 weeks, depending on your progress. A full recovery can take up to 2 to 3 months, but most patients are up and about same day of surgery.
An hour after the surgery, they get you up and walk, and you're only in the hospital 2 days. So they keep you moving, and you have to start moving right away. And the therapy starts immediately.
At PCI, we have our own physical therapists who are very well trained, keep a close eye on the patient's progress, and update us frequently as and when needed.
If you don't work hard at anything, it's not going to come out right. As soon as you start that physical therapy and you work hard at it, you will see that your knee is getting better.
He was A+. He did very well. He did his therapy very diligently, and he regained his motion very quickly.
I think he did a better job on the second knee than he did the first one, because I baked him some homemade cinnamon bread in between those two.
My aim really is truly in life is to have all my patients be free of pain, hip or knee.
If somebody came to me and asked me about their knees, I would tell them to go to PCI because of the x-ray department and everything that they have there is top-notch.
This is a medical pavilion with a lot of different specialties under one roof. So instead of going to various locations same day for the part of your treatment, they can have everything as a one-stop. Most of these patients are looking for pain relief. And if you can give them complete pain relief, it helps them keep active, it helps them to be a very active and a useful member of the community. And that makes a huge difference.
My experience with Dr. Munjo, he's very thorough. He'd come in and see me every day afterwards, and before the surgery, after everything. He was right there all the time.
This is a wonderful community. The patients, when they come back to see me in my office, and when they have no pain, they're very complimentary. They're the nicest people I have met. I had heard about I1 patients, never met them till I came here, and they are wonderful patients, wonderful. And that's what keeps me going. These patients, they're well-wishers.
My knees are great. I have no pain walking, and now I'm back to work. All the people at PCI, very helpful. I basically had no problems with anything. Everything, the paperwork, the insurance went well, everything has went very well.